All right, welcome back to Jeff Koinange Live right here at Citizen Television, the home edition. And we want to thank our guest who's been standing by very patiently. Dr. Lois Ombajo is a senior lecturer at the University of Nairobi. She also happens to be the head of the infectious diseases unit at the Kenyatta National Hospital. She joins us live right now. Dr. Ombajo, good to see you. I know you've had a really long day. I'm not going to keep you for too long, but thanks so much for your time. How are you doing?
Very well, Jeff. How are you doing?
Hey, listen, okay? Day 19, I feel good, and everything's going to be okay. You had Ambassador Macharia come out a moment ago. He tested symptomatic, and he's gone through a rough time, Dr. Ari.
Mm-hmm. He has. And again, just like I said to you the last time I was here, thanks to you and thanks to Ambassador Macharia for talking about this illness and helping to demystify and reduce stigma. The more people talk about it, the more we realize that, anybody can get it, and we really just need to reduce stigma, and that is so important. And you're glad you're doing well, that you've tested negative and you're feeling well. We're very glad about that.
Thank you, Dr. I appreciate that. Speaking of testing negative, today, Health Cabinet Secretary Mutahi Nkwagwe says, look, if you're asymptomatic, you don't need to take that test after 10 days. What does that mean?
So this is something that I guess we are also all learning a little about. As I said, COVID is new to all of us, and we're going to be learning a lot of things along the way. We've seen a lot of countries and a lot of organizations adopt this new recommendation sort of to reduce the amount of testing required once someone is well, and to reduce the amount of time that someone has to be in isolation. And really, just to explain the background and the basis for this is that, one, there's some data that shows that even though someone continues to test positive after the 10th day, then that virus may not be viable. So what they do is they take this virus that's detected and they try to grow it. If they're unable to grow it, it means that, it may not be infectious. It may not spread to other people. There are also countries that have looked at people who are positive and said if they follow up their contacts after a certain amount of time, then their contacts don't seem to get infected. So based on that, the thinking is that after about 10 days, even though someone continues to test positive, they may not transmit the infection to other people. And what does that, especially in the context of such a widespread epidemic, is that one, to reduce the need for repeat testing, which is fairly expensive, and it will also reduce the amount of time that people have to be isolated away for, long durations of time. So that's really the basis for this current recommendation.
So, Dr. Ari, are you saying because this virus is so new, that's why they call it novel coronavirus, are we flying blind for the most part here? We don't know which way it's going to turn because it's changing all the time?
I think we sort of have an idea about how people present. We have an idea about, the dynamics of disease. But the truth is we don't know everything about this virus. There's nobody who knows everything about this virus. And we'll keep learning a lot of things as time goes on. But I think the main thing is that we're able to stay safe, to keep people safe, and to get prompt treatment should anyone require treatment. But the truth is we're going to be learning for a long time with this one.
So someone like me, for instance, after day 14, I tested again. It was negative. I was told I need another test. I did a test today. I don't have the results yet. Chances are I'm going to be all clear?
Chances are you will be negative. And there are few instances where someone has tested negative the first time, then they test again and it may be positive. And that's really some of the work that's been done to figure out what does it mean if someone tests negative and positive again. And so far it seems that people will remain safe, they will not get sicker, and even more important, they will not transmit that infection to other people. So I think you are good to go.
That's some good news. Thank you, Dr. Ari. So bottom line, people out there are walking around with this virus and they don't know, right?
Yes. That's true. I mean, many people are asymptomatic. As you said, you were tested because of contact tracing. If you hadn't been traced as a contact, you'd have been walking around and going about your business. So the truth is, we'll have many people who stay asymptomatic. They never have the symptoms and they never get to know that they have infection. And this is why it's so important that in our day-to-day interactions, we continue to wear masks, we continue to maintain distance, and we continue to avoid public gatherings, because some people may have the infection and never know it. So they may transmit it without ever knowing they were infected. So it's so important that everybody adheres to those guidelines so that everybody continues to stay safe.
Dr. There are experts and analysts out there who are saying Kenya still hasn't peaked yet. What do you say?
Kenya still hasn't peaked yet. I say the same thing. And I think it's one of those things that we wish was different. But based on just understanding of disease dynamics, understanding of how infectious diseases spread, and also based on some of the modeling work that our team has done, we know that we probably have a little while to go before we peak. And what that means is that we'll continue to see an increasing number of infections. And we really have to just brace ourselves for a time when we may have a little more infections. And now more than ever, really take care of ourselves and adhere to those precautions, because we are yet to peak.
There's a term that I keep hearing every other day, herd immunity. Dr. Ari, what does that mean?
So the concept of herd immunity is one that's really come from use of vaccines for infectious disease. So if you look at some of the diseases, let's pick an example of something like measles, which was a common childhood viral infection. When you immunize a lot of children in the community, with time you have a sufficient pool of people who are immune and will not get the infection. And the fewer people get infection, it means there are fewer people to spread it. So by vaccinating a lot of people, you end up with a sufficient pool of people who are immune. So usually we don't rely so much on people getting infected to achieve herd immunity. And the reason for that is, one, with many viral infections, from our experience, is that many viral infections, after the infection, people may have some level of immunity. Having said that, because this is a new disease, again, it waits to be seen how long this immunity lasts and whether it's truly sufficient to prevent a second infection. The reason why you don't really want to achieve herd immunity all at once, people would say, why don't you just let everybody get infected so that we achieve this herd immunity? And the reason we don't want to do that is, in a disease where people get very sick and where people die, if you try to achieve this all at once, it means you will end up with a lot of sick people who need hospital care. And with overwhelming of facilities, you end up with a lot more people dying because you're unable to give them care. But the concept and our expectation is that once a large number of people have gotten infected over the next few months, then you'll have people who are a little more resistant to infection. As I said, we're still learning about this. We'll get to know how sufficient that protection is, how long it lasts, and whether it truly does prevent secondary infections. So this is a field, again, that we're closely studying, and we'll get to learn more about it as time goes on.
Absolutely. Explain something for me, Dr. Ari, if you will. I have a friend who tested positive. His wife tested negative. His child tested positive. How does that work? Explain that to me.
So I guess with many diseases, one, not everybody who gets exposed develops disease. And two, whether someone tests positive or negative is one dependent on the timing of the test. So for example, if today I was exposed to to someone who has disease, and you test me tomorrow, I will not have started shedding virus and I will test negative. If you test me after 14 days, for example, I may have gotten that infection and cleared it, and I may not test positive. So the timing of taking the test is one very important issue. The second thing is that occasionally we have what we call false negatives. So this is dependent on how a sample is taken. And then we also know that there's something we call sensitivity, the ability of a test to pick disease when disease is there. So the sensitivity of the test is not 100%. There are occasions, rare, luckily, where someone may have disease, but we fail to pick it up. So those issues of timing of the test, how the test is taken, and just the dynamics, the characteristics of this test. So in this situation, you may find maybe the wife had the virus first, and by the time they were testing her, she was already negative, or she had not yet started shedding virus, or maybe she was just one of those lucky people who never developed disease.
Let me make it a little more complicated. What if this child who's positive is still breastfeeding? Does this still go on with the mother who's negative?
So these are some of the complex situations, and you had to make it very difficult. There are some things that we sort of don't have very clear answers to, and we often want to do a sort of risk-benefit analysis, so to speak. A child who's breastfeeding, it's important that they continue breastfeeding, especially at a time when they're ill, because there are significant benefits of breast milk. So the mother would be able to wear a mask and to breastfeed that child. On the other hand, if the mother had certain comorbidities or certain conditions that placed her at high risk, then you may say maybe this mother needs to express that breast milk and it is given to the child. So there's no one size fits all. We sort of have to, look at every situation as it comes so that we give the most appropriate solution for each situation as it comes.
Okay, thanks for that, Dr. Ari. At the same time, apart from a vaccine, which is still 18 months or so away, and hopefully that'll be the panacea or the cure-all, talk to me about something that people are talking about, antibodies therapy.
So I guess one of the things is that every time somebody has an infection, and this happens with most infections, the body mounts an immune response to that infection. And part of that immune response is in the form of antibodies. So antibodies are the molecules that are produced by the body to fight, a foreign virus or whatever other organism there is. Which means if someone has been or has had an infection, you may be able to tell that they have that infection if you're able to detect antibodies to that particular infection. So in this instance, for example, if you're able to detect antibodies to the coronavirus, then you know that this person has had coronavirus. In terms of use for treatment, which was your question really, we may think that if somebody has antibodies, and these antibodies were developed because of fighting the virus, then if you gave someone who was very sick these antibodies, then it may help them fight the virus. And that is something that has been tried for many diseases. We call it convalescent plasma, that if you take my blood after I have after I've overcome an infection, then my blood may have antibodies to that infection. And if given to someone who is very ill, may help them fight infection. Of course, it has its complications and it's not always been the most useful treatment, but it's one of those things that are occasionally tried, especially if someone is severely ill.
Is that happening here in Kenya, Dr. Ari?
So there are groups that are hoping to do this as a clinical trial. Remember, this has not been proven to work. And many therapies are often not proven to work until they're taken through the process of a clinical trial. So there are some clinical trials going on with convalescent plasma in other countries. And I think there are groups in the country that are also looking at the possibility of studying that. So until we have the results from these trials, we're not able to tell whether it truly works or not.
Yeah, absolutely. Look, Ambassador Macharia Kamau a moment ago, I asked him about stigma going forward, and he was very confident. He says, look, man, I've had this, so, people shouldn't run away. People should know that at least I've been through it. But let's face it, stigma is a big problem. I have a problem. If I go out there and if I drive into a mall, I know people will be getting out of the way, which is not such a bad thing. But we have to address the stigma thing, right?
We have to address the stigma thing because of stigma, many people who are positive may be afraid to let others know. But there's merit in letting other people know, because one, if you're going about your business, you need to also protect other people. So it's important that you don't stigmatize yourself, because that allows you to go through the period of isolation peacefully. In that process, you protect other people. But stigma is real. I remember when we first started treating patients with COVID, because people knew I was a doctor treating COVID patients. Some people were a bit scared of coming to me. They thought I was carrying COVID around everywhere. But I think over time, we've seen some of that stigma go down a little. And again, as I said, it's really important when people come out and talk about it, because the truth is, at some point, almost all of us will have gotten this infection. So today it's this person, tomorrow it will be me, it will be the next person. We can't really afford to stigmatize people.
All right, Dr. Lois Ombajo, Senior Lecturer at the University of Nairobi, Head of Infectious Diseases Unit at Kenyatta National Hospital. Always a pleasure to see you. Thank you so much for your time, and all the best, and stay safe.
Can I say something else before you send me off?
Of course you can.
Okay, thank you. So I guess, one, you just mentioned something important about stigma. I just wanted to mention something about self-treatment. I know people out there are trying all manner of treatments and all manner of concoctions, and you sort of mentioned some of them. So where some are harmless, taking the lemon and ginger may soothe the throat and is not harmful. People have to be careful about taking harmful therapies, because remember, if you're taking a drug that's not been prescribed, it could potentially have side effects. And I know earlier there was a mention about maybe taking things like paracetamol for the purpose of, reducing fever. It's also important that we don't take too much of it, because too much of Panadol can actually damage the liver. So it's important that even as you're taking therapies, it's important to know what you're taking, why you're taking it, so that you're not taking harmful things that may end up damaging your liver. Remember, most people who are on home therapy and are asymptomatic don't really need any medication. You probably just need to eat healthy, do a little exercise where you can, and wait until the period of isolation is over. Thanks, Jeff, for giving me that.
Let me ask you real quick, Dr. Ari, before I let you go. Recent deaths have involved young people. Why is that?
I think it may be a reflection of just how many people are infected out there. I think we've said in the past that there are certain risk factors, certain factors that put someone at risk for severe disease, including death. But that doesn't mean that those who don't have those risk factors are safe. So because we said older people have certain risks, it doesn't mean younger people are safe. And it's very hard to predict who will have a severe disease and will be asymptomatic. So we have seen, as you rightly say, younger people who've had more severe symptoms, or even who have died. So again, we don't always and fully understand some of the disease dynamics, but we know that for every population that gets infected, there's a small percentage that runs the risk of getting severe infection. And the lesson to young people really is we cannot let the guard down and think that youth will protect people. We still, the younger people still have to be careful.
Dr. Lois, get yourself some rest and keep doing what you do. We appreciate your work.
Thank you so much. Have a good night.
You do the same. Dr. Lois Ombajo, there, Senior Lecturer at the University of Nairobi, Head of Infectious Diseases Unit at the Kenyatta National Hospital. Thank you so much. Appreciate your work. Okay, before we wind up, there's a couple of tweets I'm going to read. James Mwadegu says, pass our warm regards to Ambassador Kamau. We wish him all the very best in a speedy recovery. He has still much to help Kenya with, a well of wisdom and intelligence. And then this tweet from, she calls herself Mama Bora. This is what she says. No woman on JKL since the 34th of January of Manu. What is that? What? Bure. And Dr. Lois Ombajo is? Jerry Thorne. Maybe you should watch JKL to the very end. You never know who's going to show up. Thanks so much for being a part of the show, folks. You know, if it's Wednesday, it's all about the three letters on the keyboard that follow each other. JKL. Even if it's a home edition, will still be here as long as you're here. Keep tweeting at Koinange Jeff, at Citizen TV Kenya, the hashtag JKLive. We'll see you next week. Stay safe. Good luck. Good night. God bless you all.